So firstly, I have to thank Daniel because, I think he kind of, in his presentation, succinctly put that, although we have the ICPD agenda, that the ICPD agenda is actually fully embedded within the SDGs, and the SDGs can be looked at like thematic framings of what is in the ICPD agenda to start off with, so that we are really not talking about two entirely different documents and two entirely different things for us to follow up and monitor, but they are almost one and the same. But perhaps some are going more of a deep dive and some are a little bit more on the surface level. So with that, okay, so I wanted to say that at the 6th APPC conference held in 2013, there were certain key areas of population and development that were discussed, and these include health, sexual and reproductive health services and rights, education, gender equality, empowerment, and also looking at key population dynamics within the region, adolescents and youth, aging, family, international migration, urbanization, and internal migration population. Now, all of these are actually key considerations, right, if we want to implement Agenda 2030 in the region and enable us to really analyze, the progress of each and every one of the SDG goals with regards in these population dynamics aspect. So sustainable development, which the SDGs is supposed to handle, has three dimensions. It has an economic dimension, it has social and environmental dimension. And the aspirations of the SDGs is that in a balanced and integrated manner to promote inclusivity, distribute the benefits of development more equitably, and ensure gender equality and respect for human rights, enable universal access to health and well-being, including sexual and reproductive healthcare services, and the realization of reproductive rights, as in reiterated in the Goal 5, as well as balancing the needs of the environment with the needs of the people. Right? What are the key trends in the region that tell us about the progress made and continuing priorities in the region and at the national level in the area of population and development and SRHR? So this is just a picture of our region, and this talks about the density of people in our region, and we can see that in many countries we are really having very dense populations, right? So this is an introduction to people in the region. Okay. So Asia Pacific has 4.5 billion people in the world, and it is home to nearly 60% of the world's population, right? And it benefits two predominant population structures which have already been mentioned, which is aging and young people, right? 60% of the global population of young people live in this region, 10 to 24 years old. And so for this population in particular, we need to have investment in providing quality education, lifelong learning, life skills, and youth-friendly information and health services. Then we also have the other trend, which is a substantial aging population, which calls for improved social protection systems as well as health systems, including that of SRH services, to cater to the needs of aging populations, right? Now, besides these young people and the old people in our region, what is really important for us to realize is that more than 1 in 10 people in Asia Pacific, 400 million people, live in extreme income poverty, right? And more than one, if we look at multidimensional poverty, so more than 1 in 4 people, the number really increases, right, in the region's developing countries, experience poverty in multiple dimensions. And this includes education and its possible deprivations, health, living standards. Okay, so if we look at these kind of deprivations, the number of those who are actually poor in our region increases. A recent World Bank study estimated that without further climate change and adaptation and mitigation actions, climate change itself could force more than 100 million people into extreme poverty by 2030, right? And as we know, the Asia-Pacific region is particularly prone to climate change and environmental disasters. Now, the other trend that I'd like you to consider, besides that of multidimensional poverty, is women. Right? So gender is a critical consideration. Half of all of these numbers, whether they're people who are poor, who are affected by climate change, they are women, and women have been recognized as most marginalized and vulnerable amongst the poor, the young, and the older. And income inequality continues to be high, right? And has even increased in countries which have had rapid economic growth, like China, India, Indonesia, and the Philippines. And it is also true, income inequality has also risen even in poorer countries as Laos, PDR, and Bangladesh. So this is just a picture to show you that, in the 1990s, how in selected economy, what was the inequality looked like, and now in the red bar shows the 2000s, what does income inequality look like currently. So over time, inequality is rising in the region, and inequalities across countries is rising, and within countries also remains a challenge. And it is not only about income inequality, but also circumstantial inequality, such as unequal access to opportunities and services, including employment, education, health, water, sanitation, energy services. And this inequality affects mostly women, people living in rural areas, urban slums, persons with disabilities, migrants, and ethnic minorities. Now, why is it important for us to address inequality? Inequality weakens the basis of growth by affecting human capital, social cohesion, middle class, and the quality of governance in our countries. Social exclusions compound poverty, a lack of access to opportunity, and inability to participate in the nation's growth industries, right? So reducing inequalities is central to achieving sustainable development, as rising inequality can slow down the pace of poverty reduction. So, and this is our lady from Nepal. Okay, so although I said half of the people in the region are women, but women actually constitute 2/3 of the poor in Asia. And a fundamental barrier to inclusive economic growth has been discrimination and oppression, especially towards women and girls, and addressing the factors that exclude women from economic and political governance. So women in many key countries of the region have limited or no control on key assets such as family home, properties, etc. Women are hardest hit in the times of crisis, with most of the women working in the informal sector with no social protection and job security policies in place. Then there's also, of course, a gender gap in labor force participation, and it remains large in Western and Southern Asia in particular, and Asia in general, which needs to be addressed. So this is like gross national income and, both men and women's contribution to it, and the small light-colored bars are women and the darker bars are men. So countries in the Asia-Pacific region reflect pronounced gender inequality if you look at some of the gender inequality indexes that exist. So we have high maternal mortality ratios, a lower proportion of women with secondary school education, and fewer women in parliament, right? Social and cultural trends, and I really liked what Daniel said, such as early age marriage, perpetuate the weakened position of women in society. It affects schooling, early childbearing, has a lack of economic mobility, and women who, on the other hand, women who do work earn less than men in almost all Asian and Pacific countries with available data, with the exception of Philippines and Turkey. Yeah? So in more than half of these countries, the gender wage gap reported in 2015 was more than 20%. And available data in some countries in the region indicate that women engage in 10 times as much unpaid work or reproductive care work as men. So, except for 3 countries, which are Tonga, Palau, and Iran, all countries have ratified the CEDAW Convention, but challenges remain in terms of legislative reforms, addressing discriminatory legislations, enforcement, implementation, and monitoring, which are essential to reducing gender inequality. So now I want to talk about another dimension, which is poverty and health. Okay? So access to quality, affordable health services and people's ability to enjoy good health is a critical intervention to reduce poverty, reduce inequalities, enable social inclusion, and contribute to sustainable development. And this is a really interesting thing that appeared in the Lancet, but I do believe that it has appeared in different books in different forms. And it shows that how if you do invest in key sexual and reproductive health services such as contraception and family planning, improving access to nutrition, ensuring vaccinations, antenatal and maternal mortality interventions. This actually allows the citizenry to have increased labor productivity, increased access to natural resources in the global economy, and an increased investment in physical capital, right? So health is not something that's just as a welfare benefit, and it is also a human right, but on the overall that countries really have to recognize that when they invest in the health services for their citizens, their economies really improve greatly. So the Asia Asia-Pacific region, unfortunately, has been suggested to have the highest dependence on out-of-pocket expenditure for health, right? So this is when you fall sick, you gotta like take out money from your wallet to go and see a doctor, have a surgery, take medicine, and sometimes, unfortunately, take unpaid leave from work or lose your job when you are sick, right? And the other imbalance is that the distribution of the healthcare workers, where fewest health workers are found where the health needs are the greatest. So out-of-pocket spending is really high in the region. We can also note that countries that have been able to make substantial investment in health, have been able to enjoy economic growth and progress substantially due to reduced social exclusion and social inequality. So you can see that countries like Thailand, Vietnam, China, Malaysia, Singapore, Japan, Australia, and New Zealand are actually countries who do provide some form of universal access to health and universal access to sexual and reproductive health and rights for their citizens. So what is the linkage between poverty, health, and gender, right? So enabling women and couples to have choices and making decisions around reproduction and sexuality helps reduce mortality and family vulnerability, especially for marginalized communities. Interventions within the SDGs help reduce inequality and create greater social inclusion. So maternal mortality, as you know, it continues to be high in South Asia, and it is a key indicator within the SDG framework. But we can really see that the highest maternal deaths are in the countries that are poorer, and within countries it is higher amongst marginalized populations, poor, rural, lesser educated, migrant, ethnic minorities, and those who live in hard-to-reach areas. Unsafe abortion is estimated to cause 14% of all maternal deaths in Southeast Asia and 13% of maternal deaths in South Asia. Most at risk of maternal deaths are younger women, or adolescent women, multiparous women, and older women. So in order to reduce maternal mortality, it's not only about tracking the numbers with regards to maternal mortality, but ensuring services such as skilled attendance at birth, complete with referral services, postpartum care essential, as most deaths occur within the first 48 hours, and ensuring access to contraceptive information, especially for young people and adolescents, and as well as older women. And another critical intervention in order to reduce maternal mortality is, of course, access to family planning and contraception. This kind of tells us what are the regional trends, and though it does say that Eastern Asia and Southern Asia seems to have reproductive health needs, family planning needs have been met with modern methods, but it is equally important for us to understand where the gaps are. So the greatest gaps in the region are actually amongst, as all the DHS data would indicate, is amongst the groups of women who are poorer, who live in rural areas, who are lesser educated, and live in hard-to-reach areas as well. So, and in most countries which demonstrate high CPR and need, methods are driven by provider bias. Okay, access to contraception needs to be rights-based. We need to enable choice of method in order to ensure sustainability and ensure informed consent of those who are participating in those programs. These additional measurements will enable us to ensure rights and needs of women are being met in a sustainable way. And now comes to the favorite thing that also Daniel touched on, which is adolescent pregnancies, right? So over 40% of adolescent pregnancies are unintended and occur in countries with low contraceptive prevalence, right? However, data on contraceptive prevalence among young and the unmarried is scarce, particularly in this region. So among married adolescents, their contraceptive prevalence is lower than married adult women, right? And it can range from 6 to 47%, with the lowest use being reported in Timor-Leste. And we know that Timor-Leste has a very high fertility rate because probably due to younger women not having access, having many births, right? So for certain countries in Southeast Asia and the Pacific, there is also a tendency now of reliance on traditional methods of uncertain efficacy amongst adolescents. So it's important to get the right information to young people. So the full and free access to contraception by young people is often limited by widespread lack of knowledge, lack of access to services and comprehensive sexuality education, risk misperceptions, and stigma and discrimination surrounding premarital sex and pregnancy. Over a third of girls are married by 18 in Bangladesh, India, Nepal, Afghanistan, and Laos PDR, compared with 5% or less in Mongolia and Maldives. So this is also a huge disparity in the region. An examination of available data on median age shows a lower median age at first marriage in most South Asian countries. So the median age can be as low as 15.8, followed by Nepal at 17.5 years. There is, of course, a strong correlation, as Daniel's also mentioned, between early marriage and adolescent fertility rate and violence. So reducing early marriage is essential to reducing adolescent pregnancies, and ensuring access to SRH services and comprehensive sexuality education is essential to improving the status of adolescents, the status of young girls, and the status of women. So I really wanted to also add another dimension, which is about violence. In much of the work that the WHO has done around violence, it says that violence is indeed something that lowers the productivity of people, has an added cost to the healthcare systems, and hence reducing violence can really, improve lives, right? So violence against women and girls is, of course, a pernicious manifestation of inequality and inequity, and violence has a devastating impact on the health and lives of women. And in our region, unfortunately, there's a very high lifetime prevalence of physical and/or sexual intimate partner violence in the Asia-Pacific region, which is 37.7% in Southeast Asia and 24.6% in the Western Pacific. So, and the further analysis across the age groups actually shows that intimate partner violence is very high among the 15 to 19 years of age, which means that the cycle of violence is actually beginning very early in the life of a woman. So, and the prevalence, also hits the very young and again the very old. So this is something that we need to look at. And then in the area of sexual violence, you have sexual violence legislations exist, but there are many barriers to preventing justice for victims and survivors of rape. Removing barriers, including legal and institutional, is essential to reducing violence. So, and when you look at sexual violence, it would be also interesting to look at sexual harassment, because you can actually see that there have been some progress made towards sexual harassment legislation, and in constitutional provisions, institutional mechanisms, laws, policies, and such measures. However, communities of women most affected by sexual harassment are often in the informal, unorganized sector and industries such as garment and other factories, and in lowly paid, unskilled jobs such as domestic workers. So the laws should cover these groups comprehensively and enable ways and means for reporting. I think the recent Indian Act is a kind of an attempt, and does mention that that these linkages must be made for the most vulnerable women. Okay. So human rights conventions such as the CEDAW. Okay, so this is about reproductive rights indicators. So human rights conventions such as CEDAW mention specific measures such as maternity and parental leave, ensuring pregnant girls stay in schools and continue education, non-termination of employment based on pregnancy status, and all of these constitute essential aspects of the reproductive rights of women. But you can see that how these linkages actually build back, right, to empowering women to be economically mobile, independent, autonomous, and productive. So fulfilling these rights mean that vulnerable groups do not get left behind. So how do we move forward? So fulfillment of the 6th APPC helps us achieve the SDGs more comprehensively and more cohesively. For this region, it is critical if we can tie in population, demographics, health, gender, and inequality, because we will not be able to achieve sustainable development in the region without addressing the key social challenges in these areas. And I think that, as Daniel has said, a monitoring framework which enables us to collect data, which will enable us to mark progress and identify gaps in a thorough way, but of course without adding to the burden on member states, right? So data and statistics, robust statistical systems at the national level that monitor data on SRHR and gender equality is critical. And, but we realized that in the 2016 Committee of Statistics, many countries from the region noted they had only data only for a limited set of SDG targets. So this is going to be a challenge. In such a case, it is important to strengthen the capacities of national statistical officers to collect this data, and which are coordinated centrally, and strengthen the role of UN agencies and UNESCAP in enabling governments to do this. So we also need to enable the collection of qualitative data, which enables us to identify the determining factors of social inequality to better handle and address the gaps. And we have to somehow look at a monitoring and data work that has buy-in of member states, right, and all stakeholders through the processes of consultation at national levels, and input by these stakeholders so that there is ownership at national built up to the regional and as compared to a top-down push from the global. So this is, I leave you with a quote from a woman, partly from our region because she's from Yemen. So, and she's a Nobel Peace Prize winner. So, that the kind of world we want to actually create in this world is something that, is peaceful, is based on love, justice, accountability, and hopefully